On this week's The Next Interview, you'll hear Andrew Barnell explain exactly how leaders turn big ideas into real-world impact through trust, execution, and the courage to lead through uncertainty. Now let's get to the episode with Doland and Andrew.
Hi, everybody. Welcome to the Next Interview Show podcast. As the announcer mentioned when we came through that front door, I'm Doland White. I'm the host of the podcast. And I say this on every podcast. I'm blessed to be in this position in my life to have high-value conversations with amazing individuals. And today, I have a gentleman who's joining me, and I'll refer, at least at the start of the podcast, I'll refer to you as a gentleman. But I have a gentleman joining me. His name is Andrew Barnell. And Andrew is CEO and founder of a company called Geneoscopy. And I hope I got it right. We practiced it before we started, so I hope I got it. One of the things that I like to start every podcast with, Andrew, is just a moment of gratitude. And there's as a CEO and founder, when you're running a company, having walked in those shoes, there's 1,000 other things you could be doing and lots of other people with demands on your time and on your attention. So I just want to tell you, thank you very much for coming and hanging out with me for just a little while today to talk about leadership and your company and the challenges that you face and lessons that other leaders can take away. So grateful to have you here. Thanks for being here with me.
Glad to be here. Thanks for having me.
Very cool. So since people haven't met you yet, I thought it would be great just to talk a little bit about your journey and your path. I know we were talking about cutting up a little bit before we started talking about kids in St. Louis and barbecue and Philadelphia, but what brought you kind of through your career to becoming the founder of the company and kind of the intention behind it. There's always when organizations or companies get founded, there's always a for the sake of what? Why am I doing this? And so I'm really interested in kind of what brought you through to that and how you fulfilled it by starting your company. So I'll hand the mic back to you.
Yeah, absolutely. It's interesting that at this point I've been doing genoscopy much longer than I've done anything else in my career. I started my career in the finance industry, so worked in healthcare investment banking and private equity for about 4 years. Learned a lot, had a tremendous experience doing that. But one of the things that I learned about myself from that was that I wanted to build a company. I wanted to build an organization. I wanted to start one where I could help set the vision, build the type of culture in a place where people wanted to work. And fortunate enough to have an entrepreneur in the family. My dad started a business in the healthcare space 25 plus years ago. So I think certainly him having a little bit of that, a little bit of a mentor in him was certainly guided me a little bit. But I distinctly remember when I wanted to start a business, not really knowing what type of business, what I wanted to do, what space. I did know I wanted to be in the healthcare space. I've really always liked the double bottom line of build a business and do something that can help people.
Sure.
But it was somewhat happenstance that we founded Geneoscopy. My sister, who I founded this business with, she was getting her MD PhD at the time at WashU in St. Louis, where we're both from. She was working in a microbiome lab where they developed this technique to isolate human RNA from stool samples. She felt that it was a great platform to develop diagnostic tests for gastrointestinal health. And early on, she wasn't even asking me to be a founder. She was asking me to help with pitch deck and model building and things for competitions that she was entering to get non-dilutive funding. And so in some ways, it started organically. We were both we were both in graduate school, 2015, 2016. And over several years of working on it, we realized it really had potential. And so it took off from there.
Well, that's an exciting story, especially when you get to work, the influence of your dad kind of coming down into the business as an entrepreneur. It's fun to talk to a second generation entrepreneur. And then also to be with your sister. There's a thing I love talking about, Andrew, which is there's this old myth around work-life balance. And I always, when I talk to the folks that I coach with, I always dispel them about there's no such thing. There's only life, right? You got family and work and friends and all these things, and we munge them all together, and that's where we apply our balance. Work is a component of it. So it's exciting to hear the kind of how how you fell into it with your sister coming to you sounds like it was almost like a favor at the beginning. Come help me figure this out.
It was. I didn't think I necessarily had that many translatable skills coming out of private equity investment. I remember having a bit of a imposter syndrome, thinking,
Yeah.
well, I'm not a scientist, I'm not an engineer, I don't know, all of these things that
Sure.
felt like tangible skills where you knew a lot. But I did know how to build financial models, and I did know how to make PowerPoint presentations. So those were certainly two things I knew how to do.
Those are cool. So leaders, as you listen to this, develop those marketable skills, man. Get PowerPoint and financial presentations done. So when you were working with your sister, and we'll kind of get into the business and fundraising and some other topics that we've got. I'm really kind of curious that transition, kind of that aha moment that happened that kind of said, "Hey, wait a minute. There needs to be even more structure. You need a CEO, and we need to go do this." How did that kind of glue together?
Yeah. It's incredible to think back, right? I started my career at massive financial services institution, JP Morgan,
Wow.
hundreds of thousands of employees, right? And
Oh yeah.
There's all these systems, and you have tools, and you have support resources, and all these things. And
Sure.
I think one of the craziest things about starting a business is, for us, I remember it was two of us sitting in a room in a co-working space, no money, no product, no nothing, right?
Yeah.
Just ideas, right? And so
Right.
if I look to where we are now, today we have 65 employees. We've raised a lot of venture capital. We have our first product, which is FDA approved in the market, robust pipeline.
Wow.
A lot of the time it was just one foot in front of the other, right? Because
Yeah.
every day you're thinking about, hey, what's the next thing I can do? Is it talking to investors? Is it, running the next experiment? And so much of what we built, in many ways, it was organic. It was, what is the problem of the day? How do we tackle that? And moving forward. So in some ways, thinking back over the last 10 years, some of it is a little bit of a blur.
Yeah.
But we've been able to build a lot of that. And a lot of it comes down to bringing in good people, right? I think one of the realizations that Eric and I had very early on, I think we're talented, we're smart people.
Sure.
But one of our core philosophies was, especially in a more regulated industry where there's definitely a right way to do things and a wrong way to do things, when
Oh
you
yeah.
ask insurers or the FDA, bringing in really, really good people. And I think that was one of the things that we had as one of our core philosophies at the beginning.
Yeah, I love that, and I think that's a really important point, Andrew, when you're talking about, because I know when you're kind of bootstrapping and just getting started and vetting all the ideas, there is a lot of those moments, I think, when you're just kind of trying to figure out what's the next one single positive small step I can go take. And I think a lot of leaders get hung up on that, on I call it eating. There's an old colloquialism, eating the elephant, right? Rather than try to eat the whole elephant, what part of the elephant can I eat today that's going to move me towards the rest of it? It's probably not a politically correct statement talking about eating elephants. But anyway, I'll leave it at that.
Yeah. And I think the one thing that I do think is critical, that I think we've been good at over time, and
Yeah.
I think this is important for any leader, is, and especially when you're starting a company, there's no shortage of shiny things to chase, right? You'll always talk to smart people. Every
Sure.
single investor you talk to will tell you how you should do something slightly differently, and none of them will tell you
Right.
the same thing, right? You have all these mentors. So differentiation of signal from noise, right?
Yeah.
And what I always focus on is, what is the next big milestone that we need to achieve, right? What is the thing that takes the business to the next level? What those have evolved over time. Early on, it was often the clinical data.
Yeah.
Now it's payer coverage, guideline inclusion, volume, and revenue adoption, right? But I think,
Sure.
I think chasing shiny objects or not following the core things, putting one foot in front of the other if you're walking in the wrong direction doesn't help you, right? So kind of knowing where you're
Sure.
trying to go in the medium term, whether that's 6 months, 9 months, 12 months.
Yeah.
And then I think your analogy was a good one, right? Taking those things one step at a time and then periodically recalibrating and making sure you're still headed the right direction, headed towards those right medium term goals. I think the combination of those two are really important.
Yeah, I really like that statement, Andrew, because I think one of the things that comes into it is that, in particularly that you just made a quick comment, or we'll refer back to around recalibrating. It's that moment just to come back and check your path and make sure that are we still on the right path. I was talking with a client this morning, the CEO, and we were talking about bowling, bumper rails, right? Make sure the first question is, are you even in the right lane, right? It's not so much about the bumper rails, but are you bowling in lane 4 when you should be bowling in like lane 8? So I like that about recalibrating, just to kind of reconfirm it, because there's going to be those moments, I think, and particularly as a founder and you're building your team, where it's easy to kind of to drift, and that 1 or 2% drift, you miss the target. The goal is, because it gets bigger and bigger and bigger over time. When you were building your team, and kind of first starting to lay the foundation for the company, I think leaders struggle with people. There's a concept: I'm going to hire for a job, or I'm going to hire for a role. And when you and your sister were kind of talking about building the team that now founds it, especially with 65 people, that's a substantial team. What kind of core tenets did you set in place to help you focus on the right kind of people in the right spot, the right role?
Yeah. One of the things we established early on was a set of core values, right?
Yeah.
And so I think first and foremost, you need to find people that fit with those, cultural values. I mean, people that thrive at Geneoscopy, they're self-starters, they have passion, they have high integrity, they work well with others and in teams, right? So I think first and foremost, you need to get someone that fits with the culture and with the identity of the team. After that, I mean, one of the philosophies that I've always followed is, I want to hire the smartest, most capable person that I can, right? I'm doing a great job if I'm in a room where I'm the dumbest person, right? I do think, especially for startup founders and companies, I think often they hit a barrier as they grow and as they scale. If everything has to be in the founder's control, if you need to micromanage everything, if you need to make every decision, at a certain point, you can't scale beyond only so many hours of the day, only so many things you can 100% vet yourself.
Right.
And so if you get really good people who know what they're doing, you align them to the right long-term goals, but then you allow them to do their jobs, right? And you give them autonomy and you give them responsibility and you serve as a resource for them. I've always felt that is the way that you can scale an organization, but it starts with getting the right people that can do that.
Yeah, I think that's a really important part, especially when you're talking about real trust, real autonomy, right? To let them go do that. And it's a shift. I think I see that with some of the folks I work with. There is that shift of, I'm going to let go of that chunk of coal, right? I'm going to hang on to this piece of coal until I turn it into a diamond. By God, this is going to be my diamond. I'm not going to let go. And making that shift so that you can let your people do their job, and they feel valued. Because I think when they're being micromanaged, they feel devalued, right?
Yeah, 100%. I read, and as you get bigger, it even has to happen further down in the organization. I was forwarded an article, I can't remember what it was about, but it was about organizations when they scale and people being worried about taking their Legos, right? And that's exactly what you were pointing out. Everyone has their Legos and they want them, right? And as you scale, I mean, the way I always think about it is, if you build the company and you have a lot more Legos, there's plenty to go around, right? And that's what the organization needs over time. But to do that, people need to be comfortable with their role changing. They need to be comfortable with, what the organization is doing changing, because the company we were 10 years ago was vastly different than the company we were 5 years ago, vastly different than the company we are today.
Sure. Yeah. I think that's really important. And leaders, on your phone, look at your phone. There's a little circle with like 30, and then probably on the other side of it, whatever platform you're listening on, hit that button, rewind back to what Andrew was just talking about Legos, because that's a really important topic. Because I think what happens, and I've seen this with my teams, we develop a relationship with our job. This is my stuff. And as I move and the organization changes, I'm going to change, which means my associated stuff changes with me. And we have a relationship with it. And when we change relationships, it is not comfortable. We are not wired for change. That's why I only go to Lowe's. I don't go to Home Depot. I know where everything is. I can find it. I can see it. So when you're I've got a couple of topics I want to explore with you. And the very first is when you and your sister decided, okay, we're going to build Geneoscopy. We're going to go do this because this is and thank you, by the way, for what you're doing. We'll talk more about that at the end for the health benefits and the non-invasive approaches that you're taking. So they don't give me a glass of wine and knock me out. There's other ways to do this. We're talking about colonoscopies to be specific. Or at least I always hope for a glass of wine. When you were building funding and you were kind of, the colloquialism, I guess, would be shopping the idea, right? Hey, this is where we're going to go, and you're shopping the idea to go do it, and you're doing it in, a market that's extremely complicated. Having been around FDA a couple of times, they are no fun. Generally, they can be much no fun. So as you're kind of heading into that, what kind of challenges, because that's not an easy task, what kind of challenges do you face as you're thinking about that mission, vision, view, so that you're building credible capital, right? That's a complex thing, and I wish we may turn this into a Dan Bon Jovi kind of podcast today. We may go like 2 hours, but I would love to hear kind of your thoughts on that, because I think that helps other leaders unpack, hey, if I'm thinking about these, because there are phases in business where you have to think about capital, and you come from that market, so you had insight there. But I don't know, what was that like? It's a 9-pound question. I'm rambling. What was that like for you, kind of as you were doing that with Geneoscopy?
Yeah. A couple thoughts. I mean, I feel like we've been fundraising for 10 years straight, right? I think as a startup founder, you're always fundraising.
Sure. Yeah, of course. Yeah.
You always need more capital to grow, especially in a capital intensive industry like life sciences, where you have to run large studies, and even commercializing the healthcare space can be quite expensive.
Sure.
So it's constant. I think it's the hardest thing for a startup founder. Some of it is the time and energy and how hard it is, but a lot of it's the emotional piece, right? You got to have thick skin. In every round we've ever done, you get 99 no's for every yes, right?
Yeah.
And especially early on, when we were, 2 students raising our seed round, raising our Series A, not having a track record, not having gray hair.
Sure.
We heard everything. We heard people tell us different people needed to be running the company. We heard all sorts of things, and it's just that dynamic of there are way fewer investors out there than there are companies seeking capital, and so it is a long, arduous process. One where you can learn a lot about the business and how you need to pivot and how you need to change.
Sure.
But one that is difficult, and you're going to know a lot more than you hear yes. And you mentioned kind of the FDA component. I would say investing in life sciences companies is unique, right? You're taking on totally different risks than you take on in other sectors. Part of that is FDA. Part of that is what happens in the commercial space. Part of that is IP is unique. And so I think real impact for us was it ends up being a niche investor base that invests in life sciences, right? Very few, especially when we got past kind of the friends and family early round, people who are investing in us just because we're us, because maybe they're my cousin or a family friend. But when you talk about investors,
sure,
right, you end up with a slightly more niche universe of people that have a knowledge in that space. And then, you're also somewhat constrained by where your company's based, right? We weren't in an innovation hub where there's a lot of life sciences in Boston or San Francisco. We were in St. Louis. And so all of those were things we had to kind of work through as we were building the business.
Yeah, that's a lot of challenges. So you touched on thick skin, and I think it's easy to get lost as a leader in the difference between business and personal. So as you're kind of going through that stage, because there are a lot of no's in business before you get to that yes. It's a part of what I would refer to as part of the game. How do you keep your head? we're talking a little bit about this before we hit go. How do you keep your head screwed on straight, right, as you're going through that, so that you maintain your focus? Because a lot of times with no's, there's a tendency. We talk about drift a little bit. There's a tendency to drift, and there's moments of doubt. Are we really doing the right thing, or are we not? A simple question is, am I nuts? Um, so how do you kind of keep how do you go about keeping your mindset in those moments so that you maintain your focus?
Yeah. It's another, I think, tough aspect of being a startup founder, right? You work at a big company. I think it's hard to have the same emotional attachment to something that you built from the ground up, right? And
Right.
so I think I compare it to other jobs I've had in the past. I've had two other jobs I mentioned in investment banking and private equity.
Sure.
There's always tough things that go along with work. There's always tough decisions, things that don't go your way. I think what I had to learn starting a business was all of that felt amplified. The highs, way higher. The lows, way lower. And I think, when it's yours, when you've started it, when you care so much about it, it's not something that turns off at 5 p.m. and turns back on at 8 a.m. the next day.
No.
I wake up in the middle of the night thinking of things. If
Right.
I'm at dinner, I'm thinking of things, especially I'm with my family, because that's what everyone wants to talk about, because we're all involved in the business, right? So it really is a 24/7 thing that is top of mind. And I think the toughest thing to deal with is, you have existential threats as a small business. You have things that go wrong that, challenge the future viability of the business, and not letting that be pervasive and affect you in a big way. I don't think there's a silver bullet. I think I've only struggled with it less more recently because I've been through it. And I think one of my philosophies at this point, that I now know, is there's always a way forward, right? I think the bad stuff never seems as bad as it does in the initial moment. The good stuff is never as good as it seems in the initial moment. And execution is the way through everything. There's no problem that does not have a solution. And if you have the right mindset, if you're willing to work hard, if you're willing to face that adversity, right, you're going to figure out a way to solve it. And knowing now, having that track record of saying, look, whatever it is, we're going to solve it.
Yeah.
I think maybe lessens that, gets you off the roller coaster a little bit. But, there's no replacing or forgetting the fact that this is something you've invested a lot in over 10 years and you really care about it, which means, it impacts you emotionally.
Yeah. I understand that. So I want to go back and pull a nugget. That was a really, really good explanation, because I want to pull just a nugget out of there, that execution is the way through everything. And I love that. There's a component to that just what kind of tickled my mind there. There's a neat little video, and maybe I'll send it to you afterwards. It's from a very sage counselor. His name is Will Smith. And it shows him jumping out of an airplane, and it ends with doing parachuting. At the very end of it, it says, "God put the greatest things in life on the other side of fear."
Absolutely.
And it's that moment where you step into action and do something about it, that you get past those no's and that fear. One of the things that we talked about kind of coming into it, and I'll give you a heads up, I'm going to ask you about this later. I'm going to ask you about family, because we talked about there is no such thing as work-life balance. There's only life, right? Especially when you mix it in with family. We'll come back to that. One of the things that was in my notes, and I was going to reviewing today before we got together, was this concept of the valley of death. And I promised you I was going to ask you about it, so I'm going to ask to talk about the valley of death. I think from a business perspective, and kind of what that meant, for your organization, and kind of your perception, your comments around that.
Yeah, absolutely. And I've spent more time in the last few years, government affairs, advocacy, policy than I thought I would, right? And
I can only imagine.
And I'll maybe define my version of the valley of death, right?
Yeah.
Which is companies like ours that have to develop a lot of data and go through the FDA. I think there can be this perception that you get through the FDA and you've solved it, right? You've been demonstrated safe and effective, you're approved. And what I think people often underestimate is there can then be this huge period after that in many ways that has more daunting challenges. I'll highlight a few that we face.
Yeah,
One,
I'd love to know.
Medicare coverage, right? Or commercial coverage, right? Just because
Okay.
you get FDA approved, you then need to go through the whole process of actually having the test paid for. And for diagnostic tests, it's been historically and notably challenging to get tests paid for, even if you're FDA approved.
Mhm.
And then the third thing is, we try to practice evidence-based care in this country.
Sure.
And so, if you don't get into the right quality measures, physicians may not get credit for doing your test. And if physicians don't get credit for a new amazing test, they're probably not going to do it. So there's all these sort of successive barriers to innovation getting into the healthcare space. And there's a reason why they exist, right? This isn't an
Yeah.
app. If an app doesn't work, the app doesn't work and you delete it. If a health product doesn't work, it can have really serious ramifications. But this sort of step-by-step process of going through a big FDA approval, a big coverage decision, getting into guidelines, taking 10 to 15 years, it can really inhibit the ability for patients and physicians to get access to new technologies. It means you
Mhm.
need more capital. It means it takes more time. And so, I think it's important for us as a system to find a balance between, okay, how do you demonstrate something is safe and effective from a health perspective, and how do we set forward-looking parameters that says, hey, if you meet these, you're then in the market, you're then covered, you're then paid for. And
Right.
so, there's good examples. An example would be a number of years ago, the FDA put together a joint FDA CMS review process where if you went through it, you would get FDA coverage or CMS coverage and FDA approval at the same time.
Okay.
There's actually legislation going through Congress right now for breakthrough devices, where if the FDA labels you a breakthrough device, you have a faster path to coverage. So I think these are really important things to make sure we get patients the best and latest technology.
Yeah.
But it's something that companies like ours in the life sciences space are living with and having to work through the day-to-day realities of as we build products, build companies, and help patients.
So how do you, and thank you for that, because I think that's even outside of the body of an FDA bounded, I'll call it boundary, an FDA bounded company. I think that's a really important concept for any business owner, because there are outside influences, whether it's, I was reading an article yesterday, Andrew, about, impacts of tariffs and impacts of blah, blah, all the things that could possibly become an excuse that could, that has an impact to your business with the tendency to kind of go, I got to stop. I can't get to where I need to go. How do you, I guess, kind of going through that, how do you, as that business, how do you influence change there?
Yeah. And I think as a business leader, I think you always know there's going to be change in policy and other things. I think
Sure.
what I would ask for most is just certainty about what the playing field is, right? I think what can be challenging is if the playing field, the pathway
Yeah.
changes all the time, or if you don't know how long it's going to take for a coverage decision to happen or the FDA to review, right?
Sure.
I think if you can plan and say, well, look, this is what happens. It's this long for FDA, and then you wait this long for CMS. Those are the types of things that I think providing certainty to investors, business leaders, startup founders, so they know exactly. It could be really rigorous. Really rigorous is fine. It can take a lot of capital, but having it be known is something that people can quantify the risk around and then underwrite, right? So I think
Yeah.
from a policy perspective, what I would advocate for is a playing field where it's transparent and you know what the rules are. In terms of your question and how do you influence,
Sure.
we're very active in a number of ways. Thinking about colorectal cancer screening, which is something we're very passionate about. There's a number of advocacy societies that we support, and they have priorities to drive funding for research and advocacy and access. And so we do a lot of work through them.
Great.
We spend a lot of time in Washington, D.C., talking to people in Congress about legislation and policies that we
Good.
think would better support the innovation community. So those are two of the things that we spend time doing.
Yeah, I think that's important. I think one of the temptations, and thank you for that. Thank you for the explanation, Andrew, because I think it's easy for a leader when a situation, circumstance, or condition comes up, there's, one of the things that the big impact is lack of clarity. And there's certainly going to be unintended consequences that are going to come up that we didn't plan for. We can't plan for all contingencies. We like to think we can, but we can't. I've never had one role where I've been able to plan for all the contingencies yet. So, and at 72, I'm looking for one. If you find one, let me know. Please just call me and tell me. But it's interesting you talk about that, because I think having that clarity and then having the tenacity to go to influence an outcome, or at least go have a conversation, open the door for a conversation. What does it take to move closer to this outcome so that we can do these kinds of things? I think a lot of leaders miss that step, and part of it is merely as simple as asking for help. We need help.
Yeah.
We're ready to go, but we need help. How do we move this forward, and what can you do to help me meet that outcome? So I think that's a really, really important insight. One of the things that kind of, as you were going through that was going through my mind, Andrew, was kind of when you're in the valley of death and you're that CEO and you got custody of 64 other humans, right, that are part of your organization, you have custody of them. You're responsible for them. And those can be tough times. How do you kind of keep them engaged? How do you keep them focused? The spirit, the some would call it motivation. I tend to call it inspiration, rather than motivation. Two different things.
Yeah. I would say two things. One, I think I'm a very transparent leader.
Yeah.
One of the things I believe, and this is a little bit separate from your question, but I think it always surprises me that when people don't really know why and how their job impacts the organization, right? When they say, hey, well, this is what I do all day long. Don't know why it's important. Don't know how it's aligned with the goals, right? And so one of the things I always try to be with everyone in our company, we have biweekly meetings where we provide updates on goals. Everyone knows what our annual goals are.
Good.
We have, a lot of ways so that everyone knows what's going on in the organization and how everything impacts them. So I think first and foremost, it's everyone knowing where we are, what we need to achieve, how what they're doing day to day impacts that, because then they get it, right? People are smart and they understand where we are and where we're going. So I think that's the first piece. I think the second piece is, and this comes down to you mentioned change earlier, right? I think change is very hard. But I also think a startup has many, many disadvantages when it comes to, competing with a really, really big company.
Sure.
I think the one advantage that they do tend to have is nimbleness, right? And if you're comfortable with change, and you can pivot quickly, take advantage of smaller interim opportunities, that's an advantage that a really big company, it's a big ship that's hard to slow down, but it's also hard to turn, right? So I think one of the things that I always focus on is, hey, if you've got 6 to 9 months until FDA approval or that next big milestone like Medicare coverage, there's always other things that are value creating that you can do, right? There's other parts of the market that you can tap. There's other patients you can serve. And so it's how can you be nimble to take advantage of those while still making sure the big milestone that you might not be able to move it. It might be 6 to 9 months out. But there's always ways to continue to make progress in the interim. And so having the nimbleness and agility to target those and find those.
Yeah, I love that. So as you're kind of in those moments, and you have to smile, because it is true when you are kind of in that mode where you are in that startup, and you're even at the size that your organization is today, you can move much faster than a lot of other organizations. How do you kind of keep that? As part of that comes innovation, right? Because in order to find those things, you got to go innovate stuff. You got to go look for things you didn't see before. How do you, and we'll get off the beaten path for a moment. How do you encourage that inside of your organization as the CEO, right? There is that responsibility to keep the bumper rails and keep focused on that mission going forward. But innovation has to continue to be a part of it. How do you keep innovation alive?
Yeah, I think one of my beliefs, and I think this is supported by the data, is the only way to get the best ideas to have the most ideas, right?
Yes.
And so,
It is supported by data. Yes. Yeah,
it is, right?
it is.
It's,
Yeah.
and, make sure that, generate the most number of ideas that aren't biased by groupthink. And that's the way you get the best ideas. So one of the things that I believe in is we have a pretty flat organization. We try not to have a siloed organization. People are involved in many different things, and everyone has a voice on everything, right? And some of the best ideas that we've had for certain things, whether it was a product improvement change or a new strategy, they come from unexpected places, right? I think if you're in an organization where you assume, hey, someone's going to tell me what to do, or someone's going to tell me what's important, you might end up having 8 to 10 people coming up with all the ideas, setting the strategy, right?
Yeah,
You set an organization where everyone knows what's going on, feels like they're allowed to share an opinion, they're allowed to share an idea, and it will be listened to. It won't always be followed. It won't always be, you won't always have uptake, but you're going to get more ideas. You're going to have more creativity. And so I think that's something that we absolutely foster.
Yeah, I love that. I think that's a really important thing. I think a lot of organizations, there's a fear to solicit ideas, and there's I think from those who have the ideas, sometimes, Andrew, there's that tendency on their side to feel you mentioned imposter syndrome early, right? So there's that imposter syndrome becomes a component of it. Fear is a piece of it. Or there's the punitive side where you're worried somebody's going to raise their hand in a room and go, that's a really stupid idea.
Exactly.
And it just, people don't, if you don't build the culture that supports it, and tip of the hat to you for building a culture that supports that that's hard to do, dude. So there you go. First dude of the call. But that is hard to do. So that's awesome that the culture does that. I want to come back just for a few minutes and talk a little bit about family. And because there is a dynamic, right, with family where when you're in a family business, and I've been in family businesses and coached family businesses before, and without talking about my kids, see one going on the side over here with other in-laws and things happening. But when this is going on, how do you maintain that balance? Because there's that propensity that when we sit down for dinner or Sunday or get together for Thanksgiving, we're going to talk shop and keep good balance there.
Yeah. It's a struggle. I would say I always want to talk shop, especially when my sister is also at the dinner table.
Sure.
Well, the way I think you make it work, I am a rigorous prioritizer. I am religious with my lists and my calendar. And I think what it comes down to is it's hard, right? We all have to decide what we do with our hours in the day. Sure. But I think it comes down to really just deciding what's important. What's important to me is my business, my employees, what we're doing for patients, and my family, my wife, and I have 2 kids and another one on the way, right? And I think the way I make sure I have time for everything is a lot of things that don't fall into those 2 buckets have to get cut out. It's just the way it is, and you find time for other things. But if I decide I want to go do something else that doesn't fall into those 2 buckets, you might have to squeeze something out that's more important, right? So it's really deciding what's important. And then also knowing that, I have little tips and tricks for making sure I'm present when it's family time, right? Sometimes it requires putting the phone on the other side of the room or something else. So not that it's not a challenge, but knowing that being present and available in those other parts of your life, usually kind of between the kid dinner time, bedtime, that's kind of my no work time. And if I have to kind of pick up the work after that, I do, but kind of compartmentalizing, prioritizing are probably the ways you solve it. But I think for anyone who is very passionate about work and passionate about their business, they do know, it's a constant struggle because my head is always turning with business ideas, and sometimes you can't get it out.
Sure.
And that's not a bad thing. Like you said, if you have that personality, I think I get a lot from the fact that I care so much about work. It drives me. I think what provides a lot of my sort of self-worth and value, what we've invested in, what we build, and that's a great thing. I think you just have to sort of manage it in the context of everything else.
Yeah, I love that. I think that's so important, Andrew, especially with this. There's some of those components that you talked about I missed early in my career. I was blessed to travel about 80% of the time for a long time. But it's important. I think leaders need to pay attention to that, and leaders all say there's a bunch of places to go rewind and listen to this podcast. Listen to the podcast twice. Listen to what Andrew talks about. Just listen 2 times. Trust me. But it's really important. I think you touched on something that's critical, and that's for our self health and our own mental state, and for those that we love and care about, is step away, put it down. I mentioned to you, raised 5 boys, right? My sons used to get really aggravated with me because they grew up in the era where some of them got phones. Some of them, I've been raising kids longer than most people go to prison. But as the younger boys got their phones, they used to just they were used to it, and they were terrified because when their girlfriends would come over for dinner, I took phones away at the dinner table. And it was like, this is our time to talk. There's no phones. And they would like, please, Dad, don't take her phone because you're going to upset her. So when you're kind of heading into the, those moments with kids and with this is probably a loaded question. Do you make sure those around you know that, hey, these are kind of sacrosanct moments, and this is when my do not disturb button is on?
Yeah, I don't really. I probably don't have a do not disturb button. I think the time I take away, as opposed to saying, hey, I need to get away for 2 weeks. I never get away for 2 weeks, right? I think for me, it's about spending time with my family a little bit every day, right? So if I need to turn off for 2 hours, I think everyone knows they'll hear from me before the end of the night.
Sure.
And so I think it's, I don't know that I've put up an out of office message on my email in like 15 years. It's possible I've never done it. So I think it's more just finding constant balance in a way that, doesn't lead to burnout. And I think one of the other things that motivates me that my wife says all the time is, none of these moments with our kids in particular do you get back, right? Especially the phase they're at right now. I've got a 1.5-year-old and a 3.5-year-old. They only go through those phases once, and they're always changing. And so I never want to look back and feel like, oh, hey, I wish I had spent more time doing this or that, right? And so just always remembering that those moments are fleeting. You don't get them back. And so trying to find constant time to make sure you're present for those as well is very important.
Yeah, that's so cool. I'm in grandparent mode now. So, and with little girls, I've learned the theme song for Super Kitties. So now I have a whole different world that I live in than I ever have before. So it's a great show. Super Kitties. Podcast listeners, I recommend Super Kitties. Watch it. It's on Disney. Try a couple episodes of Super Kitties. You'll enjoy it. The kind of the last thing I mentioned, kind of heading as we were coming into the podcast, there's no elegant way out of the podcast. So I'm going to ask you one more thing, and then we'll talk a little bit about just health in general. The very first thing is I want people to understand kind of the mission of your company and what your product does, because this is a really important topic.
Yeah. So we develop diagnostic tests for gastrointestinal health. We have an FDA-approved colorectal cancer screening test. Was approved last year. It launched earlier this year. Colon cancer is the second deadliest cancer in the country, primarily because people don't get screened.
Right.
Historically, we've screened for colorectal cancer with colonoscopy, which is invasive and time-consuming and expensive. And so we've developed a highly accurate, easy to do, at-home stool-based colorectal cancer screening test. There's 44 million people in the country who should be screened and aren't. And so, we want to be a big part of that solution of getting more people screened. Colon cancer is often referred to as the most preventable but least prevented cancer. And we really want to change that. So, on our website, plenty of information about colon cancer, how you can get screened with ColoSense. And that's a big part of our mission. And then as we think to the long term, there's a number of other gastrointestinal conditions, things like Crohn's and ulcerative colitis, where we've got a great technology that can play a role as well. So that's sort of what we spend our time thinking about every day.
Yeah, I will. I'm gonna just start by telling you thank you, and for having the passion to go create this and create these tools. And I will agree with you. Being a cancer survivor myself, I've never said this on one of my podcasts. I'm going to say stuff I've not said. Being a cancer survivor myself, I had leukemia, still have leukemia. It's one of those you can't go away. But the importance of understanding cancer is extremely important. And the things you can do as an adult you can tell me if I'm full of beans, but I would say probably like if you're mid-30s, you need to be thinking about this. Kind of from that point on, you need to be paying attention to these things that you can detect in your body and go take the screening, go take advantage of this technology. Unless you really enjoy colonoscopy, and that's a whole other conversation. So, without getting into the details. But I would really recommend that. Inside of the show notes will be a link to the Geneoscopy website, and reach out to them. You mentioned, Andrew, there's information on the website there about the screening, how to get the screening, do all of those kinds of things. Take the time to go do that. Take care of yourself. You have to. As a leader, we have the custody of family, success, monetizing, all of the things that go into it. And it always starts with putting our oxygen mask on first. And if you're not paying attention to your health, you're not doing a good job. So pay attention to your health. That's critically, critically important. So just one old 72-year-old man's advice. Go do this. Trust me. I want to I end every podcast with the second side of gratitude. And I'm going to end the podcast just with one more feat of gratitude, Andrew, for, again, coming in, hanging out with me. We went way past the 30-minute mark. I told you we wouldn't make it. And I'm grateful for the insights, for the things that you talked about execution, about fundraising, about having clarity, going down the path, getting good people. There's a lot of meat to this conversation. So thank you again for taking your time, for being here and turning your head to those other 64 people that are probably sending you Skype messages and Slack messages going, where the hell are you? So, and what are you doing? So thanks, bud. I appreciate you being here.
Thanks for having me. This is great.
All right. For podcast listeners, always two things. If you enjoyed what you heard today, give the podcast a no, like, share, or follow. If you didn't enjoy it, don't come back. But if you did enjoy it, give it a no, like, share, or follow. It's important not for vanity numbers. It's important because it elevates the podcast so that it is more visible. The reason why it needs to be more visible is I have a mission of empowering 1 million leaders. That's my personal mission in life. Send somebody this podcast. If you heard something from Andrew today that you kind of went, hey, my friend could really use this help, or what this person talked about, send them the podcast. Listen to the podcast a couple of times. Read the transcript. Take some notes. Listening to CEOs and executives that have done it, succeeded, continue to do it, continue to grow is critically important. We learn from each other. So share this podcast with them.
Thanks for tuning in to the next interview show. If today's conversation gave you something to think about or something to act on, follow the show. And share this episode with a leader you know who's ready to step up, because empowered leadership isn't a solo sport.